Assalamualaikum and hi, my name is Amir Shweka binti Rosmizi. I am a Part 7 student of Bachelor of Science in Biology from UiTM Jengke, Pahang. Today I am going to presenting about my industrial training at Klinik AzZahra Pekan. The duration period for my industrial training was about 14 weeks, which is starting from 11th March 2024 until 14th June 2024. The supervisor in charge during the practical training was Dr. Muhammad Zulhafiz bin Zulkifli. This is the content that I will be discussed further. The background of Klinik AzZahra Pekan. Klinik AzZahra Pekan was established on 13th April 2023. It is a new branch of Klinik AzZahra in Pahang and located at number 7 Pusat Komersial Mahkota in Pekan, Pahang. The main headquarters of Klinik AzZahra is located at Taman Impian, Kampung Padang, Kuantan. Currently, Klinik AzZahra had 8 branches in entire of Pahang. Furthermore, during pandemic COVID-19, Klinik AzZahra had successfully opened up the first quarantine center PKRC at Pahang. Thus, the vision and mission of Klinik AzZahra Pekan. For the vision, Klinik AzZahra wants to be the most preferred clinic and to the optimum the health status in surrounding society. Meanwhile, for the mission is, the first one is to provide the best quality of health service. The second one is to provide advice, counseling and referral to hospital as needed. And the last one is to provide consultation, treatment and counseling with affordable price. Besides, based on the organization chart below, it shows that the top position in Klinik AzZahra Pekan is the doctor in charge, which is Dr. Muhammad Zulhafiz. The clinic have 2 permanent clinical assistants, which are Nur Atika and Nur Shafika. The clinic also have another doctor resident, which is Dr. Marina. Furthermore, in the organization chart, it shows that Nur Izzati was a clinical assistant before, but she already got another job before I was performing the practical training. Moreover, these are the services that are available at Klinik AzZahra Pekan. During my practical training at the Klinik AzZahra Pekan, I have been given an opportunity to doing the administrative tasks. The administrative task consists of the registering and scheduling the details of the patients when the patients visiting the doctors, cleaning the clinic such as sweeping, mopping and cleaning the toilets. I also wiping the dispensary window, cabinets and doors of the clinic every day. Besides, my supervisor also giving me the task in dispenses the prescribed medication, chaperoning the doctors, assisting the doctors for mini operations and assisting the clinical staff in order taking the heart rhythm by using the ECG. Sometimes, I also hands in registering the new incoming stocks of the medications into the Klinik system. Even though I only given the administrative task as the main job scope during this practical, my supervisor also had given me another additional task to research about a few types of commonly disease in Malaysia. The main objective for this practical training is, the first one is to acquire the practical experience, develop my personality and support patient care in healthcare industry. The second one is to obtain first-hand understanding of the range of the organization activities and extra information that cannot be found in a classroom. The last one is to get knowledge on how to effectively manage a task in accordance with a specific region or sections. For the task that I have done at Klinik AzZahra Pekan is, the first one is registering and scheduling the patients. Klinik AzZahra Pekan is using a computer system which is known as a Klinik system in order to registering the details of the visiting patients and scheduling them properly. In this case, the doctor also use the same system, so the queuing of the patient will be the same with the computer at the front desk. In the system, it also consists of the price of each medications and the services that served at the clinic. Thus, for the first month of my practical training, I usually trying to register the details of patient into the Klinik system. It is a kind of a new thing that I learned during my practical training. But at the end of my practical training, I already master using the Klinik system to schedule the patients when they are requested to visit the doctors. Then, I also assisting the clinical staff in using ECG machines. ECG machines, or known as electrocardiogram machines, is a test to record the electrical signals in the heart. It shows how the heart is beating. On my practical training, I had assisted the staff for about a few times in putting the wires of the machines on the patient's body. Then, after the machine reading the graph of the heart rhythm, the staff will print the result and I pass the result to the doctor for the further references. The doctor will consult the patients on how the rhythm of their heart is performing, either it will be positive or negative. Besides, I also chaperoning and assisting the doctor. I help chaperone the doctor when they are checking the patients, especially during on checking the development of the patient's baby by using the ultrasound scan. Additionally, I also assisted the doctor when opening the wound suture of the patients. The patient already had a few of suture on her left arm and she insisted to open the stitches as they are completely recovered. I helped Dr. Marina by getting the utensils that needed. On that time, Dr. Marina had explained to me on how to remove the stitches and she asked if I want to try to remove the stitches. It was an unforgettable memory since I had learned a new experience during my practical training. Furthermore, during my practical training, I also had registered the new incoming stocks of the medications into the Klinik system. The expiry date, batch number and the quantity of each incoming medicines were recorded. Then I will arrange the medicines on the shelf by putting them into their types of partitions. I also had dispensed the medications after the doctors had prescribed to the patients. Additionally, I will explain on the dosage and time of each medicines toward the patients, so the patient will be taking their medicines on the right amount at the right time. Thus, my supervisor had assigned me an additional of tasks every week and then we discussed regarding the topics given. Sometimes the clinical staff also join our discussion sessions. There are a few topics about the disease that commonly happens in Malaysia had been assigned to me, such as diabetes, shocks, strokes, pregnancy, and miscarriage. However, sometimes my supervisor also assigned me to make research on medications such as antibiotics and analgesics. He will explain to me clearly during the discussion session on how the mechanism of action for each type of the disease and medicines. Besides, there are also other topics that has been discussed like the types of the disease, the complications, and the side effects. There are the three impacts that I gained from the industrial training. The first one is skill development. For the skills development, I had gained hands-on experience in clinical procedures, patient care, and the use of medical equipment that can enhance my practical skills. For the second one is professional competence. I had gained the real-world exposure that helps in understanding the clinical environment, improving the decision-making, and developing competence in routine tasks. Lastly, I could improve my knowledge by exposure to the operational aspects of healthcare facilities, provide insights into healthcare systems, policies, and administrative procedures that increase my understanding in healthcare systems. As a conclusion, my industrial training as a clinical assistant has been an invaluable experience, offering profound insights and the practical skills that are crucial for a successful career in healthcare. Over the course of this training, I have had the opportunity to engage directly with patients, work alongside experienced healthcare professionals, and gain a comprehensive understanding of the day-to-day operation within the clinical setting. Besides, the knowledge and skills acquired during this period will undoubtedly serve as a strong foundation for my professional growth. I am grateful for the opportunity to learn and contribute, and I am excited to continue developing my career in this rewarding field. Overall, I would recommend that to increase the period of the industrial training. Thus, the student could gain more experiences and knowledge about the working field. That's all from me. Thank you.